In the medical industry, there are many disciplines. They all share the goal of improving, saving, or changing lives. Join us as we meet the people, discover the technology, and explore the organizations of this vital industry. We all want to live a long life, but the key is to maintain it. Now, we can only do that by staying healthy. To help us do that, the healthcare industry offers a wide range of solutions, along with the highly trained professionals to guide us. Let's take a look at what's being done to keep us on our feet and feeling great. Stroke claims the lives of around 130,000 Americans and 14,000 Canadians each year. Knowing the signs of stroke and getting immediate medical attention are critical. Just remember, fast. If you experience face drooping, arm weakness, and speech difficulty, it's time to call 911.
The commonest kind of stroke is ischemic stroke, which is caused by a blocked artery in the brain that is from a blood clot from somewhere, blocking that artery, leading to reduced blood flow and then symptoms because one region of the brain is not getting that blood.
In patients experiencing a typical acute ischemic stroke, 120 million brain cells, 830 billion synapses, and 447 miles of brain fibers are lost each hour in the absence of treatment.
TPA is the only currently approved medication for stroke victims. It's a clot buster that opens up blocked blood vessels, but it can't be given in an ambulance because a proportion of stroke victims have brain hemorrhages. So a patient has to get to the hospital, get a CAT scan, get seen by a neurologist, and only then can TPA be given. And by then, a proportion of stroke patients have brain damage, and that would result in a disability.
Instead of reopening blocked arteries with clot busters, some researchers believe stroke may be treatable using drugs called neuroprotectants. These drugs are aimed at reducing the brain's high demand for oxygen and nutrients and blocking the biochemical event that stroke initiates. While all attempts to date at developing neuroprotectants for ischemic stroke have failed in humans, stroke research expert Dr. Michael Timiansky and the team at his biotechnology company NoNO Inc. are forging new frontiers with their neuroprotectant drug NA1. NoNO Inc. is the only company in the history of stroke research to have taken a stroke drug all the way from its inception to the completion of a human clinical trial that shows efficacy.
NA1 is a drug that was discovered in our lab that we went on to test in people. The ENACT trial was conducted in 185 patients in Canada and the US, and these were people who had brain aneurysms that were being repaired. Such people suffer from small strokes, and in the trial we showed that patients who had NA1 had 50% fewer strokes than patients who had placebo. To our knowledge, this is the first time that a neuroprotective drug has shown efficacy in humans.
Now, NoNO Inc. is taking NA1 to actual stroke victims through advanced clinical trials in Canada and the U.S. As part of the trials, stroke patients who qualified based on assessment of paramedics in the field will receive NA1 in the ambulance on the way to the hospital.
Unlike TPA, NA1 can be safely administered to patients that may not ultimately have had an ischemic stroke. This raises the possibility of giving the drug as early as the first golden hour after the stroke, where you can best limit the damage from the stroke.
So this is important work because the neuroprotectants in the past have failed because they're given late in hospital. What we propose to do in this study is put them in the ambulances where the paramedics can give them early, and this potentially will transform stroke care.
If approved in the coming years, experts say NA1 stands to benefit the lives of millions of stroke patients worldwide.
I'm extremely excited about it. Our Canadian paramedics are highly trained medical professionals. We know that early intervention makes the difference in recovery and survival for stroke patients. We're excited to have our professionals treating patients in the back of the ambulance to improve their survival and recovery.
Dr. Timiansky and the NoNO team are committed to seeing the development of their emergency stroke neuroprotectant through to the end.
We're committed to develop a drug that will make a difference for stroke victims. If we're able to do this, we'll achieve something that's never been achieved before and that has the potential of helping millions of people worldwide.